So we've had quite a few calls lately asking about TMJ Prolotherapy as a possible treatment modality. Most of these calls have been from patients who've already tried some form of conservative therapy, like physical therapy and or some type of mouthguard. These people, and if you're watching this video you might be one of them, usually feel like they're getting a little bit of the runaround. They've often been to multiple doctors and dentists and sometimes specialists, and they haven't found anything that significantly alleviates their symptoms. For those of you who aren't familiar with prolotherapy, it's a technique that involves the injection of a diluted dextrose solution, usually 12.5% in the case of TMJ dysfunction, along with 1% lidocaine and sterile saline, into joint structures and tendinous insertions into bone in order to stimulate a mild acute inflammatory response. In essence, we're injecting an irritant into an area to stimulate the body's natural healing response. Prolotherapy is most appropriate for patients with joint problems, true TMJ dysfunction. Most patients I see for the first time have never really even had a diagnosis, so nobody's really even taken the time to establish a theory about where their pain or other symptoms might be coming from. In my practice, we get a very detailed history. We do a large field of volume cone beam CT scan. I do a very thorough clinical examination, and sometimes I order an MRI, all to arrive at a diagnosis, which is really still just an educated guess about the origin of the pain or dysfunction, but this time it's made through knowledge. Diagnosis. A diagnosis is a theory based on a collection of data. So the more data we have, the more likely our diagnosis is going to be accurate. The purpose of conservative therapy is to test that diagnosis or theory and see if we're right. I always recommend conservative therapy first, preferably with the help of a beautifully constructed and appropriately chosen oral appliance, mouthguard, along with my 12-week program for craniomandibular rehabilitation. For those few patients who continue to experience significant pain or dysfunction despite conservative therapy, prolotherapy can be a helpful tool to reduce joint pain, improve range of motion, and sometimes reduce joint noises like clicking. Prolotherapy is not the best choice for people who have symptoms that originate from within the muscle tissue or fascia. I actually find Botox to be much more helpful and predictable in those cases. In my office, I follow the protocol outlined in this study, which I have linked below in the description. I inject about a milliliter of the prolotherapy solution into two joint locations, the posterior and anterior attachments on the condyle, and then I'll sometimes deposit a little bit of that solution into the most tender area of that masseter muscle when a patient clenches, right where a lot of people point when they're describing the pain they feel in their jaw. We recommend repeating this procedure about 2 weeks later, and then a third time 2 weeks after that in order to get the full effect. Now you might be wondering what it feels like to have 2 cc's of fluid injected into that pretty small temporomandibular joint space. I've had several injections into my own jaw joints during various workshops and courses I've taken to learn these techniques, and I can tell you it's not terrible, but it doesn't feel that great either. The jaw joint is very close to the ear, so after these injections you can often hear and feel squishing or squeaking or even crunchy noises when you move your jaw. This can last for several days. It's also probably going to change your bite temporarily, which I actually think is a good thing. Additionally, there are some nerves that run through these areas, so it is possible you'll feel some numbness and tingling on that side of the face and back around the ear, which might last for a few hours. Sometimes people will experience Bell's palsy, which is the paralysis, usually temporary, of the facial muscles on one side of the face. I actually had this happen to me at a workshop after having an injection into my masseter. Started about 5 minutes after the injection, and it made me smile funny for about 2 hours, which everybody got a big kick out of. But by far the most common negative reaction I've seen with any injection technique in my office is dizziness and lightheadedness after the injection, which is usually attributed to anxiety about needles. So if you have a significant fear of needles, this is not something I'd recommend in my office. So I hope that helps you understand prolotherapy a little bit better. If you have any questions, leave them in the comments below. Don't forget to like and subscribe and share this video with anyone you think it might help. I'm Dr. Jeff Dolgus. Thanks for watching.